Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Gay Landstrom, who is the Senior Vice President and Chief Nursing Officer at Trinity Health, about why it's important for CNOs to have a seat at the table and how they can advocate for nursing. So, hi, Gay, how are you?
I'm great. How are you, G?
I'm doing so well. Thanks for joining us today. So let's jump right in. Obviously, CNOs play a very large role in health systems, in the C-suite, and in leadership in general. So I wanted to ask you today, why is it important for CNOs to be a part of that executive leadership team at a hospital or health system?
Oh, it's such a great question. Thank you. If you think about the responsibilities that the chief nursing officer has in a health system, in a healthcare facility, any part of the continuum, they have responsibility for all of nursing care, which is typically nursing is the largest part of any workforce, certainly in acute care hospitals. And nurses, wherever patients are being cared for, nurses are likely there, right next to the patient, aware of what that patient, that customer needs in the way of their care, their experience. And the chief nursing officer has that insight, fed every day by their staff. And they also are in touch in working with those people who are right at the front line caring for your patients, your customers. And so it makes so much sense that the leader that has responsibility for much of the product that we're producing, that care, that experience for patients, and all those caregivers that are providing that care, that you would want them to be at your executive table, so that everyone has a deep understanding of the patient and those that care for them each day. And if you think about a chief nurse not being absent from that executive table, there would be so much missing information, so much missing perspective when it comes to setting strategy or determining how to improve operations. You would just be missing some of the most vital information about your operation and about the care that you deliver. So I think they're absolutely essential to be a part of that executive team.
Hmm. Absolutely. And with nurses being typically a majority of the workforce, it's pretty critical that nurse leaders are at the table. So you've touched on it a little bit already, but how do you think CNOs can advocate for nursing in ways that other leaders can't?
Well, I think it's important. CNOs definitely need to share information. They must share perspectives and insight about the work of the nurse that is so vital to the outcome of patient care, regardless of what part of the continuum you're talking about. It's essential that they share that information and that they speak to what those caregivers need in order to really deliver the outcomes that the organization desires. But it's not just about advocating. In order for the chief nursing officer to really be a vital and vibrant part of that executive team, they also need to listen. They need to hear the perspective of others on the executive team to understand what they're concerned about as well. And in many ways, really listening and seeking to understand opens the door to be able to advocate, to be able to share what it is that nurses and patients need in order to improve outcomes within the organization. So it's really important that they advocate. They have a perspective and a comprehensive picture of nursing and patient care that I don't think many others on the executive team can share. And they also need to really learn to listen and understand and integrate those other perspectives as well as advocating based on what they know.
Absolutely. And you're mentioning working with other members of the C-suite. So what are some strategies for building those relationships with, say, your CEO or your CFO?
Yeah. One of the things that I talk about with chief nursing officers is that one of their vital skills, I think, is really becoming a translator.
Hmm.
You absolutely need to build personal relationships with other members of your executive team. That goes without saying. But it also means that you need to learn enough about strategy to speak strategy language and understand strategy language. You need to understand all the financial elements of your organization, including reimbursement and the challenges there and billing and the revenue cycle and all of those things. You've got to understand it in order to understand the language and speak the language. CNOs really have to become translators. And when they need to speak about clinical matters, about things that are really they are expert in, um, often the chief medical officer might understand that language, but if they don't really translate it, what they're trying to share into a language that your strategy person and the mission person and your Marcom leader and your financial officer, they all need to be able to understand what it is you're trying to convey. So not only developing relationships, but also being very cognizant that you need to be a translator.
Absolutely. And I've heard from a few other chief nursing officers the phrase, or just in general in healthcare, I've heard the phrase like nurses need to learn like the language of of like finances, like you're saying, but I've also heard it the other way that CFOs need to learn the language of nursing. And so how do you think CNOs can, like, what are some specific tips for teaching maybe your CFO or your CEO the language of nursing so that you can help build that case for investment in nursing programs?
Yeah. Well, I think it's important to start with what is it that we're really trying to accomplish? What is the gap? What is the need? Maybe it is to retain workforce and develop them and help them become more and more skilled in order to be able to provide the care that your community needs, that needs to be, delivered within your different service lines in the organization. Starting with what do we agree on needs to be accomplished, and
Hmm.
then being really, I think, gracious in sharing what you know, and and teaching. I have often spent extra time really helping one of my executive colleagues understand why something is important. We first agree on, this is the outcome we need to achieve, but why is this pathway? Why is buying this equipment? Why is this program important to achieving that outcome? You can't assume that your colleague from another discipline and other experience will automatically understand that. We need
Hmm.
to be teachers. We need to share information in a gracious way. We need to there have been times where really trying to help perhaps I'm remembering one of my operations officers that I worked with, and he had a financial background and was just really, really skilled, but he didn't understand why we needed to make a purchase of a certain kind of hospital bed in order to achieve some different clinical outcomes. And I needed to be kind about how I approached this, but I ultimately needed to get him in a bed. And he needed
Hmm.
to see from the patient's perspective why the equipment that we had at that time was really not going to meet the need clinically or experience wise. And until I had developed a relationship to the point where when I asked him to get into a hospital bed and
Hmm.
experience something for me, that he was really willing to do that. So it needed a base of the relationship. We needed to agree on what it is needed to be accomplished, but the how I needed to teach, and sometimes that means experiences, because something that a chief nursing officer might know innately or has lots of expertise with, their colleague may really not understand why that pathway is the right one. And so we need to be gracious teachers of our colleagues, a good partner on that team.
Hmm. Absolutely. Yeah, I've heard of other CNOs who will actually take their CFOs and like do rounds with them and walk them down like the hospital wings and everything to really get them to see what it is that they're investing in. And I think that's a really key strategy.
And
Um,
worth the time. It really is a great strategy. Being able to see something and then talk about what is it that we're really seeing here, and talk through the nuances of it, so there's a common understanding, and
mhm,
then there can be that partnership moving side by side with confidence about a strategy and a
mhm.
tactic.
Absolutely. So something that I know many CNOs are thinking about right now is succession planning and kind of raising up that new generation of nursing leaders. So do you have any tips or advice for upcoming CNOs or young nurse leaders who are just beginning their leadership journey?
Yes, actually, I've had a number of these conversations here in the last couple of weeks,
Hmm.
and it's important to really, that individual that aspires to become a chief nursing officer. There are some important things to really learn along the way in preparation. Um, an individual does not just arrive in that important role automatically being able to be successful. It's important to learn things before you step in that seat and continue learning all throughout your time as a chief nurse. You know, one of the things that I think, and I often recommend to aspiring CNOs, is our health systems are rarely just about the acute care hospital anymore.
Hmm.
That we need to meet the needs of the people in our community in a variety of ways. And it's not always about the acute care hospital or the emergency room. In fact, other services outside of acute care, are really growing, and I think will continue to grow in the coming years. If a CNO's experience is completely in the acute care setting, then they really need to ask for and seek some other learning experiences in other
Hmm.
parts of the continuum. Learn to understand what is home care, and how does that really operate, and what are their challenges from a regulatory standpoint, and hospice. What is palliative care and hospice, and why is that an important service? And how does it fit in with the rest? And PACE programs, comprehensive programs for the elderly, are growing, and that's a different way of helping keep people well who might otherwise be in the hospital, or senior care, or all those parts of the continuum. An aspiring CNO should learn all they can about that, and about payment systems, and what some of the challenges are now and will likely be in the future. All of those things are important things to learn to gain a really broad perspective and the ability to strategize, making improvements or making innovations in the care delivery system.
Absolutely. Well, that is great advice. And thank you so much, Gay, for your time. I'm really grateful to have had this opportunity to hear your insights and get to know you a little bit. And thank you so much to our audience for listening. Thank you, Gay.
My pleasure. Thank you.